Hi, I'm Raj Kumar, President and Editor-in-Chief of Devex, and I'm delighted to welcome to the virtual stage here at Prescription for Progress, Leon Wang. Leon, great to have you here. Leon is the Executive Vice President at AstraZeneca, responsible for what they call the international region, which is really most of the world. It's the countries that we at Prescription for Progress at Devex are very interested in. It's Latin America, it's Africa, it's Asia Pacific, and it's China, where you are based, Leon, where AstraZeneca is the largest pharmaceutical company in the market. You've got a big role there and in these countries and regions that we described. So I want to just begin, given this moment we're in COVID, to ask how you think the emerging markets, the developing country health systems are faring. How are they doing at this point? We talk a lot about health systems and keeping them strong and resilient. We've had a huge shock with COVID. How do you think they've held up under these circumstances?
Yeah, so across the emerging market, usually the healthcare system is underdeveloped and under-resourced. So we have less primary care physician in the village, in the town, to help the patients in the first line. So usually lots of patients for very simple disease, pediatric problem, and even acute disease, they needed to travel 5-6 hours by train, by bus to the big city and then line up for 5-6 hours again, and only asking for 5 minutes from a very, very busy doctor to get their problem treated and go back home. So you can imagine it's a very less efficient, no appointment driven. And so during the COVID-19, every government is trying their best to avoid the pandemic being spreading. So a cross infection within the hospital will be a huge problem. And so everyone is trying to manage the number of people within the hospital. So lots of people needed to wait even longer, and lots of disease are not managed properly, and they're not even able to get into the hospital without the virus check and also without a fever report. So lots of patients have a fever, but they needed to wait for 3-4 hours for the test result before they can even see a doctor. I think more patients died of other disease, chronic disease, acute disease, heart attack, stroke, cancer, than the pandemic itself. So I think it is a real area to really study, to really build I think every government is trying their best now to build a good village clinic, a very good township kind of primary care clinic to manage the situation. So in order to avoid people traveling too much, and really protect the precious resource in the big hospital to handle those acute situation and hospitalization in the big city, big hospital. So I think the emerging market have lots of similarity in that respect. So really the headache is how you can take care of chronic disease, acute disease, deadly disease, critical disease during the background of this pandemic.
Yeah, it's interesting because you're reminding me of the Ebola crisis in West Africa, now going back half a decade or so. And I believe in that case, more people died of malaria than of Ebola itself. And so you're right, the after effects, especially where health systems are weak, are big. And it's interesting in a moment we're thinking of the most, biggest advances in vaccine technology, for example, mRNA. You're talking about primary health as a core driver of healthcare, which it is. I wonder, this is a conference where we think about innovation and technology, and we talk a lot about this pandemic accelerating innovation. What are some of these innovations that you see, or do you see this opportunity because of the pandemic that we've accelerated innovation in the healthcare space in the countries where you work?
Yeah, I think the first thing, technology really can help in all dimensions. And we realize when the disease become new norm, and all the doctors are really willing to go online instead of traveling to get education. So I think lots of webcasting, digital forum, and they are asking questions, learning big congress updates, disease updates from online rather than face-to-face communication. So I think this is, to be honest, is an advance against the pre-pandemic. So and the second thing, because a lot of digital tools supporting this direction. And second thing is, in order to avoid repeat prescription patients within the hospital, so online pharmacy, online hospital consultation. So for those patients, simply come over to see the doctor, say hello, and I need a refill. So they don't need to line up in the hospital clinic. They just simply get online and maybe talk to your doctor for several seconds, right? So then to get your prescription refilled. So I think this reduced half of the population lining up in the queue. So I think the online pharmacy and the online consultation is really advancing rapidly in almost every country I can see. And in some countries, it's not even online; it's a telemarketing, right? So it's a phone call that you can get your prescription delivered to your home, right? So I think this is also another dimension. And thirdly, I think during the pandemic, when we are screening patients with a CT scan, for example, so we realized that you can not only using CT scan to scan lung cancer, but maybe you can also identify heart failure patients, and ultimately in the future you can also identify COPD patients. So I think lots of AI technology can actually be applied to help the patients in the clinic, in the rural area, in the private primary care doctor place, to help them to screen the patients. So mobile CT scan bus are driving through the countryside. So we used to have a quite ambitious plan. So that having a CT scan bus with AI technology and 5G transmission of data. So then every week they travel to 1 or 2 villages, right? So to help the patient to screen lung cancer. So later future we will add heart failure, and the future we'll add COPD to increase the efficiency of the CT scan. So making sure that these valuable resources can be properly used and maximize the efficiency.
Yeah, it's interesting because all three of your examples really do point to the need for efficiency in settings where there's few resources. You're talking about the efficiency of the patient's time. They don't have time to line up for hours at a hospital for a prescription. They need to work to feed their family. The lack of medical resources, of doctors, you need to preserve their time as well, right? And that's where being able to online consult is so valuable. And then talking about CT scans and getting the most out of limited medical equipment. Let me just, in our remaining time, we just have moments left, Leon. Maybe I can ask you what the learning has been for you personally as you think of the countries where you're working and AstraZeneca is working. Is there something you think you will be doing differently and AstraZeneca will be doing differently in these markets now that you've come through this experience of the pandemic, which is obviously still going on around the world? But I wonder what lessons there are for you personally.
If I have had a chance to go back 3 years, right? So if I know the pandemic is going to come, so I think we needed to make organization more digital. So usually pharmaceutical companies are more classical, more research, innovation driven. But this innovation are not the digital innovation. So now innovation, when we talk about innovation, it should mean including digital innovation. And as a pharma company, I think we also needed to work with Amazon, Google, and in China is Ali, Tencent. So these digital giant, right? So online giant and the e-commerce giant. So working closely with these internet companies to really improve the experience of transactions.
It's a fascinating set of lessons, Leon, and very much aligned with the ethos of this event, where we think about innovation and the way you scale it is through partnership. And that's exactly why we bring together this diverse group of technology leaders and healthcare leaders. It's been fascinating to listen to you. And I just want to thank you for taking the time and for all the good work you and your colleagues at AstraZeneca are doing. Leon Wang, Executive Vice President International at AstraZeneca. Thanks for being here at Prescription for Progress.
Thank you, Raj.